Welcome everyone to the Q&A session of our webinar, How to Prevent the Next Pandemic, Nature-Based Solutions and Policy Opportunities. I'm Charley Willison, an Assistant Professor of Public and Ecosystem Health at Cornell University, and I will be moderating today's Q&A. The webinar discussion focused on a specific piece of pandemic prevention that is not currently included in pandemic policies and is usually left out of the discussion: spillover of viruses from animals into humans. Our panelists propose nature-based solutions or ecological countermeasures to intervene at the spillover phase and prevent new viruses from infecting and potentially circulating in humans in the first place, ultimately stopping pandemics before they can start. If you were unable to join us, the webinar will remain on eCornell's website to watch free of charge. We are thrilled that you're here to join us for this question and answer session, where our panelists will respond to questions received by our audience during the live webinar. Thank you to all our audience members who submitted questions. We look forward to this discussion. And before we get started, I'd like to reintroduce our esteemed panelists. First, we have Aliyu Nuhu Ahmed, doctoral candidate at the London School of Hygiene and Tropical Medicine. Diego Mara, Director of Conservation Evidence at Bat Conservation International. Raina Plowright, Professor of Disease Ecology and Cornell Atkinson Scholar at Cornell University. Deanne Reeder, Professor of Biology at Bucknell University. Benjamin Roche, Research Director at Prisode and the French Research Institute for Sustainable Development. Iroro Tanshi, co-founder of the Small Mammal Conservation Organization in Nigeria. Abi Vanek, Director of the Center for Policy Design at the Ashoka Trust for Research in Ecology and the Environment. And finally, I'd like to welcome Neil Vora, Pandemic Prevention Fellow at Conservation International, who will be joining us for today's Q&A session. So let's jump into it. First, for our first question, I'd like to invite Ben and Neil to kick us off. How are we going to emphasize conservation of biodiversity as global policy?
Great, thanks Charlie for this question. So what we saw yesterday is that decreasing the pressure of human activities on our ecosystem is definitely sustainable way to try to prevent some of this kind of spillover events. So it will look a little bit weird why we are not doing that more often. And actually, I think there is two main obstacles for that. So the first one, of course, is getting all the different actors engaged in this kind of process. So just to show a little bit a concrete example of something that is currently occurring somewhere in the world, we have to talk about what we're doing right now in Mexico. So we're working right now in the peninsula of Yucatan, which is one of the most deforested area in the whole world. And so what we're trying to do is really to try to envision and to implement, which is quite not exactly the same thing. So this kind of prevention strategies based on conservation programs. So why it's taking so long is mostly because all the different actors are seeing the costs that these kind of conservation programs are going to involve on the short term, because of course when we apply conservation programs on the ground, it's going to have a cost. It's not a free process, and so it's going to be something costly for all the different actors on the short term, even if the benefits on the long term are much bigger, because it's going to decrease the probability to have pandemics and so on and so forth. So to get actually prevention strategy that can be applied on the ground, we really need to co-design this kind of conservation programs with the goal of preventing zoonotic disease emergence with all the different actors from all the different sectors. Could be, of course, health, but it has to be also agriculture, economy, tourism, and so on and so forth. And it's through a co-design process that we can have a reasonable and sustainable strategy that can combine conservation and pandemic prevention. I think the second obstacle that is currently really detrimental is the lack of metrics of the efficacy of this kind of prevention strategy. That's a classic dilemma in public health. We know that prevention is much better than the cure, but it's much harder to sell because by definition, we try to avoid something to happen. While when we try to cure something, we just give some kind of drugs, and then the sick people is going to be better soon. So we have to prove that this kind of prevention strategies are efficient on a long term. And so to that, we are missing metrics. So this is what we're doing right now with the WHO, but this is not just about the probability of zoonotic disease emergence. So it's also about the return on investment of applying this kind of prevention strategy. A paper published in Science 2020 shown that investing massively in prevention will cost just 2% about what the COVID-19 pandemic is going to cost to our economies. So we need this kind of metrics to show that actually designing and implementing this kind of prevention strategies is worth for economic reason, but of course for public health reason.
I'll just quickly add to that excellent response and make 3 points. The first is that we are currently facing a convergence of existential threats, all driven by the destruction of nature. And those 3 threats are pandemics, climate change, and the loss of biodiversity. Human health depends upon biodiversity. And one of the most impactful ways that's manifested is that the loss of biodiversity can lead to infectious disease emergence. And so where there are common solutions to these 3 existential threats, we should implement them. And the ecological countermeasures that my colleagues have already described is exactly that. Many of those countermeasures can not just prevent pandemics, but will also help to conserve biodiversity. Point number 2 is that last year, at the end of last year, there was a landmark agreement that basically sets the agenda for the next decade for global biodiversity conservation. Over 190 countries agreed to a global biodiversity framework that will now be implemented over the next decade. And the job of all of those countries that have signed on to this framework as part of the United Nations is that they are now developing national strategic and action plans for conserving biodiversity. So it's critical that as these plans are developed over the next 1 to 2 years, that health be incorporated in those biodiversity action plans, and specifically ecological countermeasures to conserve biodiversity as well as prevent pandemics. And the third point I would make is that people must be the center of all of this. Most of the world's biodiversity is under the custodianship or the management of indigenous peoples. And indigenous peoples have often been sidelined in many of these discussions about health and pandemic prevention and pandemic preparedness. And so as we focus on conserving the world's biodiversity and preventing and preparing for the next pandemic, we must center indigenous peoples and local communities in those conversations.
What a great way to kick us off. Thank you so much, Ben and Neil. I'm now going to invite Raina and Teague to comment on this next question. What kind of surveillance would be best to understand the spillover and zoonotic transmission?
Thanks for this question. I'm just going to put us back in gallery view there. I think it's important to remember those 3 things that have to align for us to be able to, for a spillover event to be able to happen. So you have to have the reservoir host in contact or overlap with human populations. The host has to be shedding the pathogen, and there has to be a specific behaviors or a mechanism of exposure. And so if we're going to study these systems, we really need to be looking at all 3 components and then how they align. And so I'll give you an example from the Hendra virus system that I presented in the webinar yesterday, is that we looked at the distribution first of these bats that are reservoirs for Hendra virus. And we looked at this over 25 years and showed that the distribution moved from bats being nomadic, moving through native forests, to bats being settled in human dominated areas. But that's not enough to generate a spillover event. So then we looked at the viral shedding of those bats, and it was fascinating that what we found is that when we accounted for the ecology of the populations of the areas that they were in, when they were in areas that were new, novel habitats, they were shedding much more virus in winter, and especially after a food shortage. But the bats in their historic populations were not shedding virus and were probably not a risk of spillover. And then finally, the behavior component, we use telemetry, and now we're using radar systems to look at bat feeding behaviors. And what we find is that if there's native food available, the bats are feeding in native trees. If there isn't native food available, the bats are feeding in, or many of their feeding stops are in horse paddocks. And so they have this mechanism of behavior of feeding in a tree right where a horse is grazing. And so you need all three to actually be able to see this. And so in other systems, we need to be studying all three components, but over long expanses of time and with replication in space, because these are complex systems that are very dynamic. There are many, many factors that are driving these systems. And so if we don't have a lot of replication, it's really hard to tell what's noise and what's signal. And just the example I gave during the webinar, where I had really very little time to explain, this was looking at coronavirus circulation in bats. And the key is we need studies where there is replication in space and time. So we're looking at how these bats are shedding virus in many different locations that are under different pressures. So we need to be collecting metadata to understand the environmental stresses on these animals. We need to be doing this through time, through seasons, through reproduction, through mating, through all the various life history stages of animals that can drive viral dynamics. And when we look at all of the studies that have been done on bat coronavirus dynamics, the keyword is dynamics, how things change in space and time. There really are very, very few now. We were able to say really 3 studies now that look at the shedding of coronavirus in space and time with metadata on bat health and drivers of viral shedding.
Yeah, I'll just add on to that the work that Raina just described is actually very difficult. So going out into the field, interacting with the animals, capturing, sampling, understanding what those dynamics really are is an arduous task. And there are a lot of organizations that are going out to the field to try to get this information. But we have to kind of keep a framework that sampling these viruses or these microbes is also part of biodiversity documentation. They are part of the overall systems that we work in. And even with something like bats, where we know that there are over 1,460 species, 30% of them, we essentially just know their name. And so just being able to put a name to a viral infection or to a bat is not necessarily enough. We need to have that metadata that brings the size of a population, the changes in numbers and population over time, along with the sort of ecosystems that are working with. With bats in general, we know that populations are declining dramatically. And so we're at this sort of precipice where there is a biodiversity crisis, and it's not just enough to document the stocks of what they are, but we need to know what the sort of density of what that really is too.
Thank you both. That was wonderful. And we have so much work to do. For this next question, I'd like to turn to Aurora and Deanne. So here we had a question thinking about the intersection between the wildlife trade and these habitat loss or stressors that we're seeing that are leading to the likelihood of spillover. Where does the wildlife trade fit in? How does it interact with habitat infringement? And what proportion of the time is the wildlife trade a cause of these spillover events?
I can go first. Right. So the illegal wildlife trade, as it also applies to bats, originates from a source. Someone has to go hunt the bats or pick them up. Whatever they do, they have to source them. And I think that's kind of the ethos of all of these conversations that we had yesterday and today is let's go back to the source and really stop that first jump. Okay, so the extent to which the actors outside of beyond the source, the extent to which they play in pandemic, in spillovers and whatnot, is a whole other story. And I don't think it's nearly as potent as what happens at the source. So that is not to brush aside the question. It is really to say the dynamics of illegal wildlife trade would need to basically start at the source. And it's kind of similar to hunting for food. In this case, you're hunting to sell to somebody else who transports it across the world. So I would start by saying let's think about how local people who are living right next to these populations that are, at risk of illegal wildlife trade for bats, work with them and begin to examine and explore solutions at the local level. Clearly, if you're involved in illegal wildlife trade, in sourcing them, it looks like the biggest motivation for you would be income. Unlike, what we see with hunting, where sometimes it's food and sometimes it's income or a combination, So I would think that this is kind of where you want to start to get into biodiversity credits and stuff like that. And that would then empower local people to sort of hands off and, keep animals where they are, where they roost and stuff like that. But I guess I'll leave the other part of, this sort of exploring how actors beyond the source. I'll leave that to the end, but I was just going to say real quick that the idea of any actors handling products that have already been supposedly cured, because for those animals to stay in the bags that they will be sold in, there's got to be some form of curing. The extent to which, because those are not sold wet, they're usually quite dry, they're taxidermized and stuff like that. The extent to which those will then become, virus opportunities for viruses to spread, I think is really limited. I think the one thing you want to be hitting on is that source, and I think it's kind of at the very crux of all of the conversations we've been having around this.
Great, Aurora, that's a fantastic answer. I'll just add a little bit to it. And I think that you've hit the nail on the head there, that the risk for wild meat hunting, not all of which is illegal, but the risk is at the source. I call them bushmeat related activities, right? It's the hunter who may be bitten or scratched and exposed to blood and urine and feces. He then may bring it back to the homestead where it is butchered by the woman in the family. And so that's really where the crux of the risk is. That is to say, in the African context. In other countries where wet markets, where open live animal markets are more common, then you're talking about a different dynamic. One of the other pieces, I think, to this question was asking about, if humans are working in disturbed habitats or they're going into the forest, and how does that interact, right? It's really hard to distinguish between the influence, for example, of habitat loss on the stress of a bat and where those hunters are moving and so on. I think one of the important things to think about too is that some of these wild species naturally may be living in forests, but are also what we would call peridomestic or synanthropic, and that they're perfectly happy to live with people. So you have encroachment, people move in, they set up some small homesteads, and many of the species disappear. We know we lose a lot of biodiversity when we do encroachment, but the ones that remain, the very adaptable ones, like some of the fruit bats, perfectly happy to stay in your mango tree or your roof in the case of these little free-tailed bats, right? Those can continue to be a risk. And some of my work and some of my Ugandan colleagues' work has shown that bats that are in these synanthropic areas that are living close to people, that they're in poorer health, right? So there's lots of really important nuances that we need to understand in trying to think about disturbed habitats, non-disturbed habitats, where that disease risk really is and how you can mitigate it, and particularly mitigate it in contexts where people are hungry.
That was fantastic. Thank you both so much. And I think really illustrates how dynamic this is. But our main point for all of this is just going back to and addressing the source. So for this next question, I'd like to turn to Neil and Abhi. Would you say that spillover control and pandemic preparedness is a humanitarian issue?
Abhi, you want to go first?
Sure, why not? Thanks, Neil. Thanks, Charley. I think it certainly is a humanitarian issue because this is something that Neil mentioned before as well. If you think about who are the people who are sort of on the front line of the spillover problem, it's mostly people living in forests close to animals. Most people living in the less developed countries of the world, in tropical areas, whether in Africa, whether in parts of Southern and Southeast Asia, in China. And these often tend to be the poorest people, just eking out a living, either by harvesting wildlife or even just using forest resources for their daily livelihoods. And these are the folks who are sort of, in the front lines, who are most at risk, especially from an emerging disease. And these are the folks then that probably have the least healthcare system in place. So preventing, all of these measures for preventing pandemics need to factor these stakeholders in first and foremost. So we really need to be targeting good healthcare practices, good public healthcare facilities need to be set up in these areas, because let's face it, the global biodiversity crisis, climate change crisis, all of these are not of their doing. They're sort of, are on the receiving end of it, whereas people who are living in, very urban lifestyles in the developed world have a lot of burden to bear for this. So, so the humanitarian crisis that arises out of people from, forest-dwelling communities, often being blamed for accessing these resources is rather unfair. And we need to be sort of, really moving towards more equity in terms of providing better healthcare facilities for these areas. And as well, and all the other good stuff also needs to happen. Surveillance needs to be enhanced. We do need to be, of course, talking more and more about protecting these landscapes, because I think Neil mentioned this already, is that these are preventing pandemics at source is also part of the solution for the biodiversity crisis, as well as a strong mitigation factor for the climate change emergency that we are in. So it's all very, very interconnected, and the world does have to recognize this as the crisis that it is, and try and put money for solving it at the front line.
That's a fantastic response. I'll just quickly add a little bit of data and a personal perspective. We have had 6 pandemics since 1918, 4 flu pandemics, an HIV pandemic, and then COVID. 5 of those certainly were the result of, or can be traced back to animals and related to spillover and other movement of pathogens across species. And the 6th one, COVID, was also very likely the result of spillover associated with wet markets. And so in total, these 6 pandemics have killed over 90 million people. Clearly, that is a humanitarian problem. And on top of that, those deaths were not equitably distributed or equally distributed, right? There were certain groups of people that were at higher risk of dying, particularly people who are poor, socioeconomically disadvantaged. On top of that, as Abhi was just mentioning, the tools that we use to respond to these pandemics are inequitably distributed. People who are privileged, such as myself living in New York City, have more access to vaccines or medicines than people living in, for example, a rural area of Asia or Africa or South America. So there's a lot of inequity here, and absolutely pandemics are a humanitarian problem, and prevention is perhaps the most equitable approach towards addressing pandemics, because everyone benefits everywhere equally. Just on a personal side of things, though, I was in New York City during the first wave of COVID. I helped respond here in New York City. I'm a medical doctor, and every day we would hear sirens going off in that first wave of COVID. At a frequency that I've never heard before. And in New York City, it was Black and brown people that were dying at a higher frequency than white people or people in my socioeconomically privileged position. And also, when I think back to when I went to Liberia to help respond to the biggest Ebola epidemic ever, I was working with nurses in Ebola treatment areas, and these nurses would overnight run out of gloves. How can you take care of patients with Ebola when you don't have gloves? And these people were putting themselves in harm's way because they were so dedicated to the mission. But that is a grave injustice that must be addressed. And prevention of these spillovers is one of the best ways that we can do that going forward.
Thank you both very much for providing this essential equity contextualization to these issues. So for this next question, Deanne, this one is for you. Is there any evidence of viral disease spillovers from pathogens in insectivorous bats? Would you agree the evidence thus far is limited to frugivorous bats?
Thanks, Charlie. This is a really great and important question, and I don't agree with that statement. And let me give a little context to that. The fruit-eating bats that I think this questioner is asking are those in the family Pteropodidae. They're often called the megabats. They're clearly important virus hosts. These are the flying foxes and other fruit bats. They've got well-established connections to Hendra, Nipah, Sosuga, Marburg, and are putative Ebola hosts. So they're clearly important to continue to be studied. But we focus on them too much, and I think we do so at our own peril, right? So we risk biasing our understanding if we fail to consider other bat lineages. The old world pteropodid, these fruit bats, there are 200 species out of 1,462. So about 14% of all the bats are in this old world lineage. So we're missing most of the bats if we really focus too much on these fruit bats. Again, we know that they're important, but I think that we need to really attend to the other species as well. If we look at the Ebola virus example, there's 6 species of Ebola, 4 of which have caused significant human disease. A partial Ebola sequence has been extracted from a bent-winged bat. It's an insect-eating bat in Africa. So it's clearly not just a fruit bat eating pathogen. Bombali Ebola virus is very clearly an insect-eating bat virus, and it's been detected now 5 times in 2 different species of African free-tailed bats. Thankfully, early cell culture studies here suggest that it's not likely to be a significant human pathogen. And again, when we're thinking about these insect-eating bats, the best evidence for hosting important viruses, or at least being the evolutionary origin of important viruses, comes from the SARS and MERS related coronaviruses that have been found in the old world called rhinolophid bats. These are these bats, they're readily identified. They have a little fleshy leaf nose appendage on their faces. It helps them emit echolocation calls. They have been extensively studied, and the diversity of viruses that have been detected in them is really quite extraordinary. And we believe, again, that somewhere in their bat viral lineage are the ancestors to the SARS-CoV and SARS-CoV-2 and likely MERS viruses. So here's an insect-eating bat lineage that is really, really important for us to continue to study. Number of bat species around the world also host the lyssaviruses. This is the group that contains rabies and its relatives, right? So there's a lot of reasons that we need to be attending to the insect-eating bats as well. And we also really need to pay attention to the likelihood of bridging hosts, right? So we know in many of these systems, there may be a pig or a horse or some wildlife species like duikers or monkeys and apes. And so that potential for bridging hosts between bat viruses and humans needs also to be studied. So it's just, there's a lot of really interesting viruses that have been detected in insect-eating bats. In my work in Africa, nearly every viral lineage has been detected in nearly every family of bats. But again, these are just viral detections. We don't know what a single finding really means, and so much more work is required. Most of these viruses are very likely not going to be of human relevance, but we need to continue our surveillance efforts and study all of everything, which is hard to do. So we have to focus in on what we think is most human relevant when we study these viruses.
Thank you so much, Deanne. This is such helpful context. For this next question, I'd like to turn to Ben and Neil. So how does all of this fit in with biosecurity policies?
Thanks, Ben. Biosecurity threats are absolutely a part of national security. We can point to many examples of how outbreaks, epidemics, and even pandemics have destabilized countries, which not only causes problems within that country, but then those security issues can expand to cause regional instability and also global instability. Just think about, for example, elections that have taken place during epidemics and pandemics and the challenges when it comes to sustaining those elections and making sure that people can practice their right to vote in very safe ways. But we also know that a health threat anywhere is a health threat everywhere. I'm not the first person to have said that. I've borrowed that terminology from other people, but a person who is infected with a pathogen in one part of the world can very easily, within hours, be on the other side of the world because of our interconnected global travel modes, such as airplanes, and with them carry that pathogen, and then there can be further pathogen spread. So we need to be thinking about the security implications of our ongoing destruction of nature, our encroachment on nature, and how we are creating the very conditions that are leading to more spillovers. I'll add a point, though, that whenever we have these security discussions, biosecurity is often sidelined in favor of other conversations on nuclear, radiologic, or chemical security. And that's a grave threat to everyone's well-being, because the threat of biological warfare and also spillovers is only growing. And whenever we do talk about biosecurity, quite often, again, the focus is on deliberate or accidental releases of pathogens rather than spillovers and prevention of spillovers, which is why the conversation that my colleagues have been leading over the last day has been so important, is that spillover prevention is being neglected, and we must include that in our larger security discussion.
No, I do agree. I think Neil gave a fantastic answer. So the only point I would like to add on that is really this need to think globally about this kind of thing. So as Neil already underlined, so all the different populations are connected through the world. So it's not just about trying to improve security on our land, which could be in the US or in Europe. Of course, we have this kind of bias to think about what can happen at home. So we are just one world, and so it means that what's going on in Southeast Asia, in Latin America, in Central Africa, also in Europe, in the US, may have an impact through the world. So it's very important to not just let all these different countries and partners inside the countries just trying to deal with their own security issues, because they are of concern about everyone. So it's very important to have this discussion at a global scale. I think something which is missing also at some point is this lack of coordination. So right now we don't have something which is really coordinating all these different kind of things. So of course we have the WHO, we have HOHA, we have the quadripartite, we have a lot of different expert panels. But who is really coordinating all these different kind of efforts is kind of a black hole for now. So it's very important. Well, meaning coordinating is not a meaning for supervising. So it's really to connect all these different experiences, just to be sure that the same thing is not done 3 or 4 times, and there are other important things that are not done at all. So it's very important to have also coordination mechanisms to really connect these different kind of experience, these different issues and concerns through the world, just to be sure that all these different concerns are addressed globally.
Thank you both. That framing of the global policy landscape is so critical.
Charley, can I just add to that?
Oh,
sorry.
Yes. Yeah, no, absolutely.
I really like the point that Ben made about coordination, and believe it or not, I just had lunch with the immediate past Minister of Environment for Nigeria, and I invited her to the talk yesterday, so she watched the webinar and she was giving me some feedback, and she was like, "This is great. We just need coordination. We need a Paris moment for pandemic prevention using ecological countermeasures." I was like, oh my gosh, I'm gonna tell my people, but this is really what it is. It's that coordination, because if you think about what's going on with just about everything else that's planetary scale, there's been some coordination with biodiversity, climate change is kind of picking up speed, and it's kind of going off anyway. But pandemic prevention is still very much a I do my own bit, so to speak. And like, I think it was Abby who was talking about how a lot of the places where some of the really terrifying things come out of are still under-resourced. And so a lot of that needs to be included in that coordination as well. And in fact, while I still have the floor, I might as well go on to say that capacity building is really crucial for all of this. Local capacity building. I mean, where do we even begin to talk about capacity and how it is so inequitable where it's needed versus where it's concentrated? And what happened? What did we see during the COVID pandemic? I was just on the island of Principe, and having these conversations with people who are always in far-flung places around the world, what happened during the pandemic was they all had to shut down and go home. Almost all international organizations did that. And in fact, the population crashes that we had for bats in the bat that we protect in Nigeria was because the international partner that was primarily protecting the forests had to sort of jet out in a sense. And so you leave local people without they don't have the resources, the governments are not prepared to do this, but we all need to prevent pandemics. We really need to be thinking about how to really make it all work at the local level while coordinating globally.
Absolutely. Thank you so much, Aurora, for bringing it back to the local equity issues. Teague, this next question is for you. So during the webinar, many of the presenters talked about human disturbances on wildlife to be contributing to disease spillovers, especially in bats. How about natural bat population increases following successful reproduction? Would population control in the wild also help limiting spillovers?
So to bring it back to what bats actually do, we'll focus on bats for this. So bats are really long-lived for their body size. For of all of the 18 different animal species that live longer for their body size than humans, 17 of those are bats. So they live a really long time. When they do that, they also have only usually one baby per year. And so their reproductive capacity or reproductive output is really, really low. And so they're not putting out lots and lots of organisms. They're not even replacing themselves and their fertilization partner for that year. So every year there's a low risk of population increase. And what we've actually seen from all of the species, essentially, except for one, that has been monitored globally is that we're having population declines, largely due to land use change. Some disease invasions, particularly North America, has been driving a lot of that for those species, but everywhere else, bat populations are declining. And what we've seen when there have been attempts to cull populations, to manage populations, to manage a particular disease, we see this with rabies outbreaks transmitted by vampire bats. When you go and you try to cull that roost, you don't necessarily get all of these bats who are carrying rabies, but you do increase their stress loads, they're going to increase their viral loads, and they're going to go out into the environment and potentially infect other bats as well. And so you're going to put this out into the environment from a single action where you're trying to manage a population. The same thing has been seen with Marburg virus, with trying to manage Egyptian fruit bats, where you go and you try to get all of those bats and decrease your own risk, but you actually are spreading that out further. So you actually increase those risks. So it's a bit of a balancing act. And if you think about this as a sort of theoretical exercise, you try to cull some bats in response to environmental change, that change continues, you cull more bats, and eventually you get into essentially an ecological death spiral where you're no longer able to manage the system that you're in. And so it's often better to sort of take a step back, think about the biology of the animals, and then what can you do that's going to buffer them a little bit more instead of trying to reduce their population sizes.
Thank you so much for that, Teague. For this next question, I'd like to start with Aliyu and then ask Aurora and Teague if you'd like to jump in. What alternatives for food sources do bat hunters have? This question, the person who asked the question is asking that, or saying that they don't see how you can eliminate the bat hunter's food source.
Thank you very much. I think in most communities, there are actually quite a lot of alternatives. Some people hunt them just because they prefer them for certain reasons. It could be, as we said previously in the seminar, for traditional medicine, of which you have alternatives, in clinics. It's just that probably access to some of these clinics is not readily available. There are also a lot of other animals where there are no adverse risks, so the risks of hunting those animals are actually quite low. And as we know that there are no limitations, there are limitations on only some type of wildlife in certain areas, but in most cases you have a ban on hunting bats, for instance. So other people, even though we do not advocate for that, could shift to other species of animals, for instance, those that they are licensed to be hunted in some particular areas. while we discourage hunting of wildlife, we are pro conservation of wildlife, we would say there are other animals that are less risky in terms of spillovers, and then other wild animals that are also licensed to be hunted in certain countries. But then generally, I would say there are lots of populations of livestock, chickens, for instance. They are all over some of these areas where bats have been hunted. And people could turn to that in place of bats. All we need is to continue to educate people that there are, drugs that can cure some of these diseases, the reasons why they hunt bats, or there are other food sources that provide the nutritional needs that these bat meats would be able to provide, and they are readily available, and try to let them know, the risks and the dangers associated with hunting bats. Then I believe they would turn their way from hunting bats for food source into other sources of food that is less risky for spillovers.
That's a brilliant response. And in fact, some of the work that we do in Nigeria asks these questions of local people. So I'm going to expand that question a little bit beyond the hunter to the consumer, okay? So whereas the hunter is probably just one person plus maybe a family of 5 or 6 people that they have to feed, if you're getting 4,000 bats, you're not feeding all those bats to your family, you're really selling them. And it's those people who consume them who go to knock on the hunter's door and say, do you have bats today, or when are you going to hunt them? So there's local demand. And so there's been this question, the question we always ask local people is, what would you prefer? And, we'll have them rank preferred animals and beyond. Before even considering that question, one of the big things that's really striking in some of the work that we're doing is that people say, I will take a chicken or a cow or beef meat, but I can't find them in my village. I'm talking about really remote communities where it takes you 3 hours to drive or 4 hours to drive on a rough road. It's really remote. Okay, so they're not getting supplies in many places. Vendors are not getting to them, except maybe once a week, someone with pork comes in. And again, we're talking about hunter-gatherer communities that are not used to animal husbandry at all. So any alternative has to take these things into account. Just telling people to go buy meat, well, they're going to need to be able to find the meat to buy in the first place. Okay, so if it's not there, how do we then work with vendors to bring meat into the communities? But if it's something we can farm locally, please, one of the biggest outcomes of some of the reviews that we've made for alternative livelihoods in our project area is a lot of other projects have tried to set up alternative livelihood projects. For hunter-gatherer communities, it's going to fail if you're not doing long-term extensive agricultural extension for farming animals, because they just don't know what to do, period. You go into some of these communities, you don't see chickens walking around. They're not there. Okay, just because people don't have the skills for those. So anyway, we've kind of gone from protecting the bats in the forest to actually working with the communities and really making sure that if we're setting up alternative protein, it really does get some sort of long-term sustainable measure to carry it forward. And for now, we are what's it called now? The African cane rat that grows up to about 7-8 kilograms is the preferred meat at our field site, at one of our field sites. And that's really just the case that they really prefer it because it tastes a bit more like venison, is like bush meat. It has the bush meat flavor in it, whether or not you're getting from the wild or you're farming it. So that's really cool. So we'll carry on doing that, but there are people who would prefer chicken and they're not, it's like somewhere around 14%, but the vast majority would prefer something that tastes like rats, more or less. But there's the extension side of things, there's the business side of things, there is the veterinary side of things. And so we're really pulling all of these resources, which I am a biologist, field biologist. All I know is to put out hop traps and mist net to trap them. But now we're pulling in a lot of consultants and people who can help with all of these different steps to make sure that when you set up alternative protein in communities, it is sustainable. It's not a, bring 5 goats or 20 goats and then, 3 months later, 4 of them are gone, and before you know it, you don't have a project. And it really has to be sustainable if we're trying to do this at all. So yeah.
Yeah, those are amazing answers. The only things I guess I really wanted to add is that both Iroro and Aliyu highlight that it has to be focused on the communities of interest and the reasons that they're going after these different kinds of things. And it varies across the world in the communities that use bats for a variety of reasons. And so yeah, I think sometimes the consumption of bats gets a little overly focused on. And one of Iroro's points earlier that we really have to be focused on the source. Like, what is the source of the potential risk? Sometimes it could be the animals in themselves, but sometimes it could be the habitats that the animals are going back into. And so it's like really taking that step back, working with the communities about where are their levels of risk, where are those mitigatable levels of risk is the really important thing. And not necessarily giving them one or another alternative, but finding that constellation of things that's really going to work well.
Thank you all so much. And I think this discussion leads really well into our next question. And for this, I'd like to invite Abi and Aliyu for this one. The person who asked this question said that they really appreciate the ecological approach to this issue highlighted by the speakers in the webinar. And they say that communication in a manner that helps individuals understand the ecological services of wildlife and their habitat is critical. But they're wondering, how can this point be emphasized while still reducing human fear of zoonoses?
Thank you very much, Charlie. I think, first of all, we have to be clear that conservation of wildlife is a win-win situation. So, it increases ecosystem services while reducing the risks of spillovers. So when you're conserving biodiversity, for instance, through several of the countermeasures or of the measures you're taking, you tend to strengthen the barriers to spillover. For instance, if we say protect where bats eat and sleep, you're reducing the risks of people coming in contact with bats, for instance, in that particular measure, where you would want people to avoid where bats feed or where they roost. And so there is less contact between bats and people while you're conserving the bat population there. So it's really the case that when you're conserving wildlife, you're reducing the risks of spillover. So there is no advantage that when you're conserving wildlife, you're overbreeding the population, or there's a risk of spillover because you're conserving them. If you look at the three mechanisms, we're talking of land use change, energy imbalance, and then the changes of behavior. Certain measures that would be taken, for instance, to preserve wildlife would be able to strengthen barriers to spillover as regards to these three mechanisms. Like I said, decreasing human-animal contact or human-reservoir contact, decreasing encroachment into the habitat of wildlife reservoirs, and also behaviors of people when there is land use change in some of these habitats where wildlife reservoirs live, then you have new access routes, and it encourages people to have easy access to these habitats and hunt them. But when there is a conservation measure there, for instance, avoiding the habitats in total, then you don't have access routes, for instance, where people would be encouraged to hunt these birds. So I think the case is that it's a win-win situation, and wildlife conservation and biodiversity preservation is really the way to go forward. So ecological countermeasure is really a very efficient and effective choice in terms of primary prevention of spillovers or pandemics.
I'll just add a couple of more points to Aliyu's excellent response. When it comes to risk of zoonosis, people sometimes don't associate or don't associate their illness as having come or as being a zoonosis. For them, it's mostly a fever of some sort or the other, especially people who are very, directly in contact with or either forest-dwelling communities or people at high risk. So in many of these cases, for sort of drawing the relationship between their behavior and the risk of getting contracting a pathogen, often then takes them on a journey of trying to understand what it is that they do that puts them at this risk of contacting this pathogen. And it could be not just we've talked a lot about bats, It could be other kinds of pathogens. It could be, coming into contact with contaminated water that has leptospirosis in it, for instance. It could be tick-borne or chiggers or mites. There's all sorts of other vector-borne diseases that are also that people are susceptible to. That also that come from risky behaviors. So people just going about their daily lives and livelihoods in these forested landscapes tend to contract some of these diseases, because some of the things that they do puts them at heightened risk of either getting ticks or of getting mites or fleas, or being in contaminated water, for instance. So education is important, but also increasing public health facilities for them where these illnesses can be diagnosed rapidly so that they don't become life-threatening is also very important, because that's where the fear really increases. It's sort of like the fear of the unknown. If you don't know what it is that you have, then people start becoming afraid of everything. As one of the examples I gave in the talk yesterday of people who benefited from bats, they were aware of the risk of Nipah because this area had a Nipah outbreak, but they continued to appreciate the benefit that bats brought, and just simple measures like maybe using gloves to pick up the fruit, or washing our hands thoroughly afterwards, making sure they don't eat any fruit that has been potentially contaminated by bats. These are all simple measures that one can take. So it's in some essence, it's allowing people to use the environment in the way they've been using it, but with a little bit of additional science. Because remember, some of these people have been using these landscapes for hundreds of years, and they have been exposed to these kinds of diseases. But with modern medicine, we're able to prevent unnecessary deaths. Vaccines are available for a lot of potential diseases now. And simple measures can really help us, alleviate or mitigate some of these risks. So yeah, it's all of these basket of interventions need to be out there for reducing disease risk.
Thank you both very much. And once again, that discussion leads us really well into this next question, which I will turn to Raina for. Would you consider vector-borne diseases in this discussion as well?
Well, vector-borne diseases are a huge burden of mortality and morbidity worldwide. And with climate change, we expect to see major shifts in the distribution of vector-borne diseases, or increase in the distribution of some vector-borne diseases. But we didn't consider them as pandemic potential pathogens because vector-borne diseases are always limited by the distribution of the vector. And so it's very, very difficult then to have a global distribution of a vector-borne disease, even though locally they're very critical.
Thank you. And finally, to wrap us up, Deanne, I'd like to turn to you. How is stress identified and measured in bats?
Great, thanks, Charlie. We talked a little bit about stress yesterday in the webinar, and we talked about how it can be a reflection of energy not being available to the animals when they need it. For example, some trees have been cut down. We also talked about stress being generated from harassment of bats that might happen through hunting activities. It also, in times of pandemics or outbreaks, can occur when people sort of villainize bats. We sometimes call them epidemic villains. And so they're being harassed and roosts are being destroyed because of the fear of viruses in them. And so we end up like these sort of like whole population level stresses. When we think about how to measure stress in bats, right, we have to think about the individual level, and we know how to do that. And we then think about the population level. Individually, we can run around in the field like I sometimes do with these little veterinary handheld devices, and we can actually assess bat health. We can take tiny blood samples and look at stress hormones, particularly the glucocorticoid hormones, cortisol and corticosterone. There's a variety of ways in which we can assess what sort of condition that particular animal is in, and we have to understand that particular species fairly extensively to be able to put everything in the appropriate context. At that population level, we may see bats having higher prevalences of pathogens. That's one indication of population level stress. For example, Teague brought up the Marburg virus example earlier when there was an extermination attempt and then bats returned. They all had higher levels of Marburg virus than they had before. So we see that sometimes with viral prevalence might increase. The bats might abandon a roost site and other changes in behavior. So we can track things both at the individual level and at the population level. And those are things that sort of population ecologists and bat ecophysiologists have been working on for some time. And that work continues to this day as I think a critical part of our understanding of what these bats need in their environments and how we can continue to protect them.
Well, that's it. Thank you to all of the audience members who submitted such great questions. Thank you to our esteemed panelists for such a lively and insightful discussion today to really help paint this picture of the dynamic processes of ecological countermeasures and spillover and how we can work to prevent the next pandemic. And just as a reminder, if you haven't gotten a chance to watch the webinar, it will remain available on the eCornell website, and feel free to share with your networks.